Hi, it's Will Shannon here, and I'd like to introduce you to the emotional part of the course. Now, I'm a big believer in what's called brief therapy. Now, brief therapy is something that came out of the 1970s. Now, if you're familiar with all of some of the work of Sigmund Freud, who's considered the father of modern day psychotherapy, Freud was an absolute genius. Freud came up with some absolutely amazing theories and innovations and things that have been really, really helpful. But unfortunately for us who work in, unfortunately and fortunately, for those of us who work in helping professionals, helping professions, a lot of Freud's work has now been superseded, and we've actually got a lot of even more quality information that we can use from schools like cognitive behavioural therapy, neuro-linguistic programming, a variety of things. But brief therapy basically came out of the 70s, which was the idea that you are not your childhood, although that's going to be a huge shaper in who we are, but it's really about we're in the present. How do we change our behaviour, change our emotions, influence ourselves, influence our loved one, really have the life we want in the present? So brief therapy was the idea that, instead of going and talking about your childhood for years, you would do 10 to 12 sessions and you would begin to make some profound shifts and shift some really substantial areas of your life now. But what's perhaps more important than that is understanding now people do some therapies in little as 1, 2, 3 sessions. In fact, there's some therapists that can wipe out a lifetime phobia now in 15, 20 minutes given the right tools. And this has been technology that's been around since the 1970s, at least in Western countries.